It's Tuesday the 6th of April and you are very welcome to this talk. Now, a bit of international news today, looking at the UK, then looking at the situation in Europe and particularly Eastern Europe where things aren't good. But let's start off with the UK where things do seem to be improving really quite dramatically. So the news is that yesterday the Prime Minister and his scientific advisor stood up and said basically the roadmap of reopening is continuing. So the next stage is on the 12th of April, next stage in the roadmap. Now, we have gone through this quite a few times, but I've got the roadmap here. We've looked at it several times. So we've had the step on the 8th of March and the 29th of March now, so that's good. At the moment, we're allowed outdoor gatherings, 6 people, 2 households, 6 people or 2 households. We're supposed to stay local. We can have guests in the garden, can have a beer and a sandwich in the garden, and outdoor sports are allowed. So the next step is the 12th of April. Now, this sounds like a fairly dramatic step, but actually it's a relatively low risk step. And when you actually think about it in these terms, this is actually quite a well thought out strategy, actually. I didn't realise quite, it's more sophisticated than it looks at first glance. So from the 12th of April, 6 days time, pubs and restaurants open for outdoor drinking and eating. Outdoor, which is fine. Non-essential retail opens, hairdressers and some public buildings like libraries. Outdoor settings can have alcohol takeaway, beer gardens. Zoos and theme parks seem to be opening. Again, outdoor activity. It sounds quite reasonable. Indoor leisure like swimming and gyms. Now, the key thing there is going to be the ventilation. Hands, face, space, and don't forget to ventilate, because people often do. So it depends on the calibre of the ventilation. That would depend on local managers ventilating their spaces properly. Self-contained holiday accommodation and campsites opening. Still no indoor mixing between households. And more on international travel. And basically we're going to have this traffic light system, red, amber, green, but that's for a separate occasion. Now, the step after that is going to be the 17th of May. And this is the one that might cause an increase in cases because that's when 2 households can mix indoors. So from what I know, I'm pretty confident there's not going to be a resurgence in cases from this 12th of April reopening. Although it does give us a lot of liberties that we haven't had lately. It's the one from the 17th of May, the stage 3, 5 weeks later, that's going to be the more critical one. But anyway, more on that in a minute. Let's look at, so 12th of April, next stage. Now, this is Professor Graham Medley, SAGE member. Eventually, indoors, highly likely, direct quote, resurgent hospitalisations and deaths. So remember, this is the 17th of May. So household mixing is going to recommence on the 17th of May with 2 households. So like 2 weeks after that, there'll probably be more people getting sick and going to hospital. 2 weeks after that, there's potentially more people, unfortunately, who could die. Now, the numbers are expected to be small. That's why this is there. But highly likely that there'll be an increase is basically what this professor is saying. And of course, they have access to all the modelling data. But then he covers himself quite a bit. It really just depends on the impact of the vaccination. So I'm more optimistic, I think, than he is at the moment, particularly on transmission and whether or not people can get infected and pass on the virus. Now, my understanding of this is... My understanding is I don't quite see why he's saying this. Vaccination is going to reduce transmission to some extent. How much we can argue about, but he does seem to be giving a fairly pessimistic appraisal there, which I suppose is good. You know, it's not good to have high expectations. But I'm slightly more optimistic that the vaccination is going to reduce transmission. But he says we just don't know, so he's a SAGE member, so I have to give it a tick because he's well informed and has access to much more information than I do. The only thing that we can be sure of is we don't know exactly what's going to happen. Well, yes, that's always true in life, isn't it? I'm afraid. But we know that because the vaccine isn't 100% effective, well, of course not, there will be some transmission. So, yes, some transmission, but this is not quantified. I'm fairly hopeful this is going to be minimal, especially as we're going to be in summer. And there will be some breakthrough of immunity. In other words, there's going to be some new infection. Yes. Again, what on earth does he mean by some? Of course, he doesn't know either. We don't know. So after 17th of May really is going to be the time when we will find these things out. Until then, we've got this next reopening on the 12th of April and the 5 weeks to find out if that's working. But I'm very optimistic about that because of the outdoor nature of most of the new activities. Now, there was a question about will we need hands, face, space sort of thing after the 21st of June, or is everything going back to normal? So will we need hands, face, space, physical distance after the 21st of June? The answer, he believes, is yes, and of course I will concur. We're not going to get rid of this pandemic this year or next year. It's going to take several seasons. Chris Whitty believes it's going to become endemic. So precautions like mask wearing, which, to be quite honest, it's just, I mean, I'm just so used to it now. It would feel really weird going into a supermarket without a mask on now. You know, I think it's a very low cost intervention. So there'd be no reason not to carry it on. Now, other news from the UK. Moderna vaccine should be with us soon. And the Johnson & Johnson Janssen vaccine, we're hoping, is going to be approved pretty soon. I'm expecting soon. Moderna, of course, already approved. Nadhim Zahawi, vaccine minister, said that the Moderna should be with us in the 3rd week of April. So that's like in a week or two's, well, yeah, 3 weeks time, 2 weeks time, really, isn't it? So we'll be getting some Moderna. I must say, I was expecting a bit earlier. I was expecting this in March. It was flagged up as arriving in March. Don't know what the delay is. Expect Nadhim Zahawi knows what the delay is. But there is going to be some on the 3rd week of April, but more volume, he says, in May. So it sounds like a lot of Moderna. And I think we've got 17 million coming. So a lot of Moderna coming to the UK in May. And of course, lots of experience from the rollout in the United States that we know quite a bit about now. This is a direct quote. We've got the Janssen vaccine coming through as well. So it sounds like he knows something we don't. I assume he's in touch with the regulators and that they. I can see no reason why this is not going to be approved for at least emergency approval pretty soon. Now, this idea that everyone's going to get 2 tests a week. Interesting. 2 tests a week. Now, this is the government site, so you log on to that, just click onto that, and it'll tell you where you can pick them up near you. Let's hope the rollout is organised. Now, you probably know already, I'm not totally sold on this idea, really, because there's going to be some false positives, and therefore people are going to have to take a PCR test, presumably if they have a positive test, we assume. But I suspect there's going to be a lot of false negatives because it depends on very much on how well you take the test. So when we get the details on that in more detail, we'll look at it. We'll look at that on the channel. I assume it's a swab from each tonsil, and we'll go through the anatomy of that when we get that guidelines, and then a nasal swab as well. But the possibility of false negatives there, I would say probably reasonably high. I don't have a figure. And of course that can give a false sense of security. So I don't really quite follow the thinking on this, but this is what's happening. Paid for as part of the NHS Test and Trace funding, 37 billion over 2 years. I mean, you know, I think the government's actually gone a bit mad here. The amount of money it's spending, you know, 37 billion is just astronomical sums of money, and it's just 37 billion. Yeah, I'm not an economist. I don't pretend to understand these things, but it does seem like they're spending like there's no tomorrow. And on an intervention such as testing, which, okay, it's nice, but I don't know of any evidence of efficacy. I don't know that studies have been done demonstrating that there's efficacy here. Anyway, it's going to be 80% of the test and trace budget. So, okay, yeah, they're fairly cheap as an individual, but yeah, I'm not convinced. We will see. I will reserve judgment, and we will see. I'll put a few question marks over that because I'm not convinced. So there you go. 4 question marks is enough to indicate my curiosity and lack of comprehension. Right, COVID certification passports, whatever you want to call it. Oh, I was just listening to an article from Israel. The BBC were just talking to a journalist from Israel, and they're basically being rolled out there now. Now, what was really interesting, she said, and I haven't got data on this, this is just from a report, but she said in Israel that you'll get authorization, your green passport or your green certification, what you want to call it. I think it was a week after your second injection. And that gives you access to things like international travel, returning to the country as long as you're tested on the departing country without isolation. It gives you a lot of extra freedoms. International freedoms, certainly. How much that's going to impact on domestic freedoms, not so sure at the moment. But anyway, the thing that she said was really interesting was if you've been diagnosed as having COVID the first time, then that diagnosis counts as your first vaccination. So I thought that was interesting. So people that have been definitely diagnosed, presumably with an antigen or an antibody test in Israel, then that counts as the first vaccine. So then they only have to have one vaccination and then they get the green pass 1 week after one vaccination. So if you haven't had it, you get vaccinated. A week later, you get green certification. If you have had it, you've had it, then you get one vaccination and then you're certificated. So the infection is counting as the first vaccination in Israel. And I get people asking me questions all the time about this. I've had the disease. Do I still need vaccinated? The answer is go and ask your doctor. Of course, I don't give out medical advice, but that's what they're doing. That's what they're doing in Israel. So the infection counts as the first vaccine, and I must say that does seem to make quite a lot of sense. Right, so COVID passport certification soonish in the UK. What's going on, we're not really sure. Being argued about. Mobile app, given the government's efficiency in rolling out mobile apps, don't hold your breath. Autumn could be indeed optimistic. So the test counts as 180 days, or evidence of vaccination, or evidence of a test. Any of those three will give you green certification. Right. Now, it seems to be a Danish company that's in charge of the app. Don't know much about it, but Mr. Gove, Michael Gove's in charge. This is some kind of mass participation event trial. So there's like football in Wembley Stadium, World Snooker Championships in Sheffield, nightclub and a comedy club in Liverpool, and a Herefordshire mass participation run, apparently, are being used as like an experiment, really, a dry run of whether this certification is going to work. Nadhim Zahawi, vaccine minister, it's only right that we should look at these options. Allow us to take our lives back, like the sound of that. Take our lives back. I want to do things as normal. I want to go to my mates. I want to go out for a drink. I want to go out for a meal. I want to have people round. I want to go around people's houses. I want life to be back to normal. And this should provide reassurance, which does sound reasonable. It will come down to a Commons vote in the UK, not getting into UK politics, but there's a lot of Conservative MPs are against it, so it depends which way Keir Starmer decides to jump. If Labour support it, it'll be passed. If Labour don't support it, because of the amount of dissension on the government side, it probably won't be passed. Personally, for me, I don't have an issue with it. I would like it to be time limited. That would be my only main proviso, that it would be time limited, because we don't want mission creep on these things. But if it's time limited, that could be, I don't really see too much of an alternative. For international travel, it's going to happen. No question about it for international travel. Right, France. Now, let's just look at the situation in France here. New confirmed cases per million. So France, as an illustration of Europe, we see it basically, we see cases going up in France compared to the United Kingdom. And we're going to have a brief look at some Eastern European countries as well. Hungary, Poland, Ukraine, United Kingdom. Unfortunately, that graph really speaks for itself, doesn't it? Okay, France, first of all, fairly high population, 67 million. Big third wave, particularly in Paris. Health Minister speaking, saying infections will peak in mid-April. So another couple of weeks yet before infections peak in France. In other words, they're going to carry on going up, according to the Health Minister, at least for another week and probably two. They are not at the peak yet. And if infections are peaking mid-April, that means hospitalisations are going to peak early May. Deaths will peak mid-May. This is baked in, unfortunately, into the French numbers, and by extension, quite a few other European countries as well. Just remind ourselves of the figures there. So that is the adjusted per capita cases in those countries. Difficulties really in France. Hospital admissions will increase until the end of April, they're saying. Okay, right. Paris ITU, by the end of April, between 2,800 and 4,400 people in intensive care. Compared to the first wave, 2,700. It's going to be higher than the first wave. They are going to really be struggling. And this doctor says they're already doing triages in the suburbs of Paris. Basically, that means not everyone can have intensive care all at the same time. And you don't need me to tell you that that means some don't get the intensive care they would normally get, which has survival implications. Now, let's just have a brief look now at the some of the Eastern European situation countries where things are bad, as we've seen. There's some examples there. Czech Republic, the cases have gone up and down dramatically, but they have gone down consistently over the past couple of weeks, which is good to see. Now, Eastern Europe, Poland, 38 million, highest number of new infections ever. Strict lockdown now. So there was a strict lockdown last year. That's now eased, which is probably why there's more infections. Schools, shops and businesses now closed again. Again, churches limited number over Easter. Of course, Poland, Easter, massive cultural... There's massive cultural disruption. For Poland, of course, being a very Catholic country, and Easter massively important in their culture, and yet often it's been highly modified. The spread's caused by the UK variant. Silesia patients are airlifted out. Silesia region in Poland, of course. Intensive care full. Demand for vaccine immensely high in Poland. So the demand for the vaccine is there. Supplies often are not. Hungary, high mortality rate, lower population. Highest rates of cancer and heart disease in Europe, I think, in Hungary. Or I don't know if they're highest, but they're high. Of course, these countries were under Soviet control till when was it? Was it 90? When was Hungary liberated? Was it 90? Around about 1990. Could have been 91. Anyway, going on with Hungary, high fatality rate in people needing ventilation. Because this is why the government have bought 16,000 ventilators, so good proactivity. But in Hungary, a lot of the medical staff left the country and work overseas, and this is a massive problem. So they've got these ventilators, but no one to work them. 25% down on doctors, 30% down on nurses, largely due to emigration. 5,500 doctors quit last month, presumably mostly going to work overseas. About 20% of the population are vaccinated because they're rolling out the Sputnik V, which we have data, good efficacy data for, and the Sinopharm, which we do not have published data for. So if I was asked which one I want, if I live in Hungary, I'd have the Sputnik because we've read the peer-reviewed paper on it. Sinopharm, still a bit of a mystery. We need peer-reviewed publications on that. Ukraine, large population in Ukraine, mounting pressure on hospitals. This is the way the BBC now spell Kiev, so I'll take their word for it. Central shops, schools closed, public transport limited, vaccine rollout limited. First dose, 250 million AstraZeneca, dear me. And there seems to be a lot of vaccine hesitancy in Ukraine, in stark contrast to Poland. So Ukraine, the countries where vaccine hesitancy seems to be most in Europe are Ukraine and Bosnia. Whereas in Poland, they can't get enough. And then briefly, the country next to the Czech Republic, Slovakia, lower population, all sorts of political shenanigans going down. Don't pretend to understand it. So the Prime Minister stepped down, some sort of secret deal over 2 million doses of Sputnik vaccine. Don't know what happened, but basically switched jobs with the Finance Minister. First dose 15%. So just these sort of political things don't really, you know, this instability doesn't really help. Czech Republic has gone up and down in terms of cases, and there's 25,000 white crosses in Prague Town Square, but again that probably has some political significance. So not particularly good in Europe, and things going to be difficult in Europe into summertime, no question about that. Right, let's go on to our special report from Australia. Dr. Susan Oliver sent another report, which I know a lot of you find interesting. So, Dr. Oliver, let me see if I can find you, ma'am.
Hello, this is Susan from Australia with another COVID update. Now, I'm going to start this update with what is some concerning news out of Australia, and that is we now do have a case in Australia of a patient with a clotting disorder, which seems to be similar to what's been seen in Europe and the UK. Now, in Australia, there's been over 400,000 AstraZeneca vaccines administered, and they're all first doses because in Australia, as in the UK, we're giving them at a 3-month interval. Now, this case isn't actually cerebral venous sinus thrombosis. This patient has clots in the abdominal area, but he does have a low platelet count. It's a 44-year-old male, so not female, and he's currently in hospital, not in the ICU, but we don't know very much more about his condition because of patient confidentiality, hopefully because they do know exactly what the problem is. They will be able to successfully treat him. Now, at the moment, the advice in Australia hasn't changed regarding getting vaccinated. So anyone who is eligible to be vaccinated should still get vaccinated. However, both patients and doctors are being advised to be on the lookout for symptoms, and in particular, symptoms that occur for between 4 and 20 days after vaccination. So we all know straight after vaccination, you know, there's various sort of flu-like type symptoms you may get. No need to worry about them. But if, you know, after 4 days you start to get headaches or abdominal pain, particularly if it can't be treated with paracetamol or other over-the-counter medications, you should urgently seek medical attention and go to the emergency room for a full workup. Now, the condition that's occurring seems to be quite similar to something called heparin-induced thrombocytopenia. And heparin is a medication that's given to people after orthopedic surgery, or in other cases where they're not going to be able to move a lot, and it's an anticoagulant. It's also, in the case of heparin-induced thrombocytopenia, there is an immune response which causes the blood platelets to be destroyed. It's also similar to a condition called immune thrombocytopenia, and same thing, it's the immune system that starts to attack platelets. This is also seen following a number of illnesses, and that includes COVID. Now, what I find slightly curious about this is that there's also been a number of cases of thrombocytopenia associated with the Pfizer and the Moderna vaccines, but no one seems to be talking about them. I'm obviously not an expert, and the experts know a lot more about me, and I'm sure we'll find out more why no one seems to be concerned about the cases following the Pfizer and Moderna vaccines, which may not have anything to do with it, likewise as not everything, because we know not everything that occurs after vaccination is related. But I just find it curious. Now on to the outbreak, which I discussed in my last update. Not long after my update, there was a substantial increase in cases, and that actually prompted Brisbane to go into a 3-day lockdown. And the main reason for that was because it was clear that there was a second cluster that was not related to the first cluster. Now, the second cluster turned out to be from a nurse who did work at the same hospital as the first case, but the case wasn't from the same patient. So the first case was a patient from Europe. The second case was a patient from India. And when I say they're from those countries, I mean they travelled from those countries. They would have been either Australians or permanent residents. They were both the B117 variant, which just shows how far it is travelling through the world. Now, the main spread in this second cluster actually occurred at a hens party, which was in Byron Bay, which is a holiday town in New South Wales. And there was obviously a number of women at that party. They were all infected. There was also someone who the media keeps referring to as an entertainer, and that's how they do it. They put it in like when you see it written down, it's in inverted commas, entertainer, nudge, nudge, wink, wink. They were all infected. They also identified 1,400 close contacts of this party. So a close contact in Australia is someone who has been face-to-face with someone for 15 minutes or someone who has spent 1 to 2 hours or more in the same enclosed area. So of those 1,400 close contacts, so far only one of them has actually tested positive. And that just shows that you are really much more likely to get COVID from friends and family than what you are from strangers. And I think that a lot of that is because, well, one, obviously you spend a lot more time close to your friends and family, but also your guard is down when you're with people you know, because you don't think you could possibly catch something from someone you know, as opposed to all those strangers. So when people are out in the community, they tend to keep their distance, wear masks where appropriate, but that doesn't happen with close contacts. Now, the first cluster, which when I spoke last time, no one actually knew how it had spread from the doctor to the index case in the community. It turned out it actually didn't. Although it was genomically, it seemed to have been genomically linked to the same doctor, but it turned out there was also a nurse at that hospital who had treated the same patient, and she had been infected with the virus but had remained asymptomatic. So she then spread it to her partner and also to a bunch of her friends who were the main people who tested positive. There's also been a couple of community cases from that, but everyone else is now in quarantine. And so we're feeling fairly confident in Australia that it's under control. And there are still a few restrictions in Australia, but pretty much Australia is now open, which is very different from what it was this time last year. So this time last year, the whole of Australia was in lockdown. You could only leave home for 4 reasons. That was to buy food or essential supplies, to seek medical advice, to get exercise, or to perform essential work. So very different this year. I think last year at the time of the lockdown, there were a lot of people who were pretty unhappy about it. I think now most people are quite happy we went that route, and I certainly hope that the lockdowns that are now occurring in other countries have a similar effect and that the whole world soon gets COVID under control. Hello, this is Susan from Australia with another.
Good, thank you for that, Susan. More to come on that vaccine story, I'm sure, but interesting to get the Australian perspective. Thank you for that. And it's just great to see the way the contact tracing and everything's so well worked out in Australia. They get to the bottom of it and they actually nip it out in the bud almost every time. So the only time being when there was that outbreak in Victoria. So great to get news from people on the ground. And I think that is us for today. More things to come I'm working on at the moment, but that is that will do for now. Okay, thank you for watching.